Hi everyone, I'm Scott Gregg, being joined today by Dr. thatfracture of the Dream Dental Group in Commerce Township, Michigan, to discuss fillings. Dr. Quacha, tell us the different types of fillings that dentists offer.
There are basically two types of fillings that most dentists offer. There are silver fillings and white resin fillings. These days most people want the white resin fillings, but let's talk about the difference. Silver fillings are just an amalgam of different types of metal, mercury included, and resin is made up of tiny particles of resin of different densities that make up like a putty that's light initiated. It's hardened using a light, so it's hardened immediately. So for instance, if you get a silver filling, there's no chemical bond to the tooth. You're just packing a hole with a bunch of metal, okay? And metal over time expands and contracts with hot and cold. So it can often cause tiny micro cracks in the teeth after many years of use because of all that expansion and contraction that can happen. So personally, I've seen happen a lot where people have relatively small silver fillings in their teeth but come in one day and have a large piece of their tooth fractured off because teeth are essentially crystalline. So if you get those tiny micro cracks in there, they grow and grow over the years and then a chunk breaks off. And then they end up needing a crown. Whereas with resin fillings, there is a little shrinkage of the material upon initial setting, but then it doesn't expand and contract quite as much. So you don't see that quite as often.
Is one filling better than the other or offer a particular advantage?
With the resin fillings, you can cut less tooth away because you use an adhesive to chemically bond that material to the tooth, so you really only have to drill where the decay is. Whereas with the silver, because there's no bond to the tooth, there is a minimum depth you have to drill in order to allow the silver to be retained within the cavity preparation. Because if you drill too shallow with silver, it'll pop out. Where with resin, it will stick, so you can keep a very small, tiny filling with a resin, but the silvers are always going to tend to be a little bit bigger.
Dr. Quacha, what about the durability of the two fillings?
So I personally don't offer silver fillings anymore, mainly because I find the white to be less invasive to the tooth. White fillings can be repaired, refinished, resealed, whereas when the silver starts to deteriorate, you have to replace the whole thing, ultimately, usually removing more tooth structure. So as far as longevity goes, most studies show, from what I've read, they're pretty close to the same. Some show silver being a little bit longer, but again, you have to look at the big picture. What is least invasive to your tooth? Which material are you going to drill less tooth away with? And that's going to be white filling material. Plus, it looks a lot better, and it doesn't have mercury in it. Those are the big differences.
Dr. thatfracture of the Dream Dental Group in Commerce Township, Michigan, thanks for joining us today to discuss fillings. I'm Scott Gregg. Thanks for watching.